When someone has a heart attack, the clock starts ticking. But what happens next isn't just a frantic rush. It's actually a precise, step-by-step medical playbook. Today, we're going to walk through that playbook, breaking down the treatment for what's called an NSTEMI, a really common type of heart attack. We'll follow the entire journey, right from the emergency room all the way to long-term recovery. So you have to wonder, right? What really goes on inside those hospital walls? Well, it's not chaos. It's a highly coordinated protocol, and every single step is designed to save heart muscle and, ultimately, to save a life. Let's pull back the curtain and see exactly how it all works. So, here's our game plan. First, we'll nail down the diagnosis, what an NSTEMI even is. Then, we'll jump into the immediate response and the care they get in the hospital. After that, we'll look at the long-term recovery plan and, of course, all the critical safety checks along the way. Okay, let's dive right in. Look, before you can fight the problem, you have to know exactly what you're up against. And when it comes to the heart, the little details, the specifics, they matter a whole lot. The first step is getting the right diagnosis. An NSTEMI is a serious heart attack where one of the heart's arteries is partially blocked, which means part of the heart muscle is being starved of oxygen. The way they confirm it for sure is with a blood test. They look for high levels of a protein called troponin, which basically leaks out when the heart muscle gets damaged. And this right here shows you why that specific diagnosis is so important. An NSTEMI is different from a STEMI, where the artery is completely blocked. With a STEMI, you're racing to the cath lab to physically open that artery. But with an NSTEMI, the first move is aggressive medical management. They're just fundamentally different paths from the get-go. All right, let's get into the immediate actions. From the moment of diagnosis, that clock is ticking loud. The first 24 hours are absolutely make or break for limiting how much damage is done to the heart. So the first line of attack is this 1-2 punch of what are called antiplatelet drugs. First up, a 300 milligram loading dose of aspirin, followed by a 300 milligram loading dose of clopidogrel. Now that term loading dose is really key. This isn't your everyday baby aspirin. It's a big upfront dose designed to get the medicine working in the bloodstream as fast as humanly possible to quickly make your blood platelets less sticky. And this quote pretty much says it all. This is the whole why behind that aggressive start. It is all about damage control. You're trying to hit the brakes on the process that's causing the heart attack and stop that partial blockage from becoming a full one. Okay, so once that initial crisis is under control, the patient is usually moved to the coronary care unit, or the CCU. And here, the treatment really broadens. It becomes this sophisticated multi-drug strategy to get the patient completely stabilized. You can think of this as the in-hospital toolkit, and each drug has a very specific job. You've got anticoagulants to stop new clots from forming, nitrates to manage chest pain and help blood flow, beta blockers like bisoprolol to give the heart a bit of a break and reduce its workload, and really importantly, something for gastroprotection to shield the stomach from this pretty powerful cocktail of medications. Now, this is where things get really interesting, because this is where the care becomes personalized. The go-to anticoagulant is a drug called fondaparinux, but it's not a great choice for patients who have kidney problems. So, in those cases, the doctors will switch to an alternative like deltaparin. It's just a perfect example of how the protocol is tailored to the individual. And here's another one of those critical safety details. IV nitrates are fantastic for getting chest pain under control, but they also lower your blood pressure. So the medical staff has to make absolutely sure the patient's systolic pressure, that top number, stays above 90. If it drops too low, the heart itself doesn't get enough blood, and you could actually make things worse. It's a constant balancing act. Now, the work is far from over when the patient leaves the hospital. In fact, a whole new phase begins. We're shifting gears now from acute crisis management to a long-term strategy. And the whole point is to prevent this from ever happening again. This recovery journey, as you can see, is a marathon, not a sprint. It lasts a full year. The hospital sets the patient up with the first month of medication, kind of like passing the baton in a relay race. Then their local doctor, their GP, takes over for the next 11 months, guiding them all the way to the finish line. So what's the big takeaway here? After that massive loading dose at the very beginning, the patient settles into a daily maintenance dose for 12 straight months. It's usually 75 milligrams of aspirin plus 75 of clopidogrel. It's this consistent daily commitment that builds a real shield against another event down the road. Of course, with a treatment plan this powerful, you've got to be vigilant. You have to be careful. And the protocol has tons of built-in safety checks and adaptations for different patient needs. These checks are totally non-negotiable. I mean, treatment is stopped immediately at any sign of serious bleeding. Allergies, of course, are taken into account, and blood clotting time, which they measure with something called an INR, is watched like a hawk. If that number creeps above 2.0, it means the blood is getting too thin and the bleeding risk is just too high for some of these drugs. And the protocol is smart. It also accounts for other health issues. For a patient who also has diabetes, if their blood sugar gets too high, a special diabetes team is brought in to manage it with insulin. And really importantly, every single NSTEMI patient gets screened for undiagnosed diabetes before they're discharged. It's all about treating the whole person. And finally, every single one of these cases is documented and fed into a national database. Now, this isn't just paperwork for paperwork's sake. This is how the entire medical community learns, how they refine these protocols, and how they make sure the standard of care is always getting better for everyone. So we've followed this incredible path from the ER, through the CCU, and onto a year-long recovery plan. What's the biggest thing to take away from all this? Well, NSTEMI treatment is this amazing blend of a standardized, science-backed protocol and a deeply personal journey for each patient. It's a long-term, multi-pronged attack on the problem, and it just reminds us that saving a heart takes both a brilliant plan and the wisdom to adapt it.